until we connect.
Yeah.
Looks like we have connected.
Okay.
We are live.
Okay.
We are live.
Are you going to say it?
Me? Alzheimer's. Welcome to What They Forget to Tell You. Episode 27.
Hi, Luann.
Luann.
From
in
Ireland.
We got
All the way
Ireland.
from Dublin.
Hi, Sandy. So we're episode 27 already. I do this every week. I'm like, already. But isn't that kind of crazy that it's been 27? Well, I would say it's been more.
Hi, Uncle Ken.
It's been more than 27, I think, but because you were trying to balance out the podcast.
There's something amiss there, and I will never figure it out. So it is what it is. I mean, you're probably right. Hi, Sin. You're
Cindy who?
Oh God.
Who's that?
Are you gonna?
Who that? Oh, Nash is in the house. 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 What were you saying?
I don't know.
Oh.
I don't even know what I'm saying. I'm so distracted. Something about there. I think it's way more than 27.
Yeah, it is. But I think we're balanced out now, right, with the podcast? No?
I don't. Probably not.
You had one job.
I know.
One.
I don't think I have one job. I'm pretty sure I'm up to 40.
You're like in Living Color, the Jamaican,
Yeah.
the Jamaican guy.
Hey,
Like
Mom.
the 10 job. All right. So, how are you this week? You're looking much more alive and vibrant.
Thank you. Thank you. Thank you very much.
Um,
Okay. Dylan, not Scratchy.
You can call him whatever you want. Scratchy's in the house. Scratchy's in the house.
Hi, Dylan.
How are you?
I'm good. Can you put your phone down?
I'm trying.
So
Can
rude.
I get onto the socials? Would you like me to get onto the socials?
What's the social?
You tagged me on Facebook. I have to make sure that my peeps can see this. Gosh.
See, she's working. See? Those nurses. Luann's a nurse, so she's working, but she's watching. What time? What's the time difference in Ireland? Hey,
Kalina.
Kalina. You were supposed to be on. Didn't you get my message?
Rob. Hi,
Hi,
guys.
Rob. Okay.
Hello, everybody.
All right. So,
Just making
are you
sure.
finished with the socials?
I'm just trying to make sure that I can get this going here, and then we're. Oh, whoa, that was odd. Okay, we're good now.
Okay. No.
Socials are good.
Okay. Good. It's 11:40 p.m. What? Are you on the midnight shift? Obviously. Okay. Don't need to answer that. What?
Nothing.
Okay. You're at a live show? Okay, we're very honored that you're at a live show and you're still watching.
Thanks for tuning in. And as always, guys, we'll start off with just saying that we're grateful for all of our followers and everybody who comes in consistently every week to tune in when they're at live shows, when they're like at work, when they're just doing stuff.
But does it count that they're family?
Doesn't matter. They're still tuning in.
Okay, Lou, I don't know. See, it's not looking good for Ireland. I'm very sad.
Explain what happened. Your viewers want to know.
Okay, so Jalen, his graduation's on the 28th, and the conference is the 28th and 29th.
Alicia's dance recital is the 28th.
So obviously I will not be able to clone myself, so I'm going to Jalen's graduation.
Oh, she's going to be devastated.
Maybe I can tune in. Do it live, and I'll tune in. Hi, Sue.
Okay, so you were saying you couldn't. Oh, because of the graduation, you can't go.
It's not looking good. I don't see how I can do it. I wish I could do it, but I don't know how I'm gonna do it. But you never know. So we'll see.
All right. So, what are we talking about today, this week?
Self-care. No, because it's mental health illness month, right, Cindy? You're just
Cindelicious. Where are you?
probably hiding. So you want to talk about self-care, like the same thing, the same topic, which is very important. Self-care and looking after yourself and making sure you're healthy. Bill was talking about that, he just found out he had diabetes. Like, these are really important things to make sure that your health is on point. Mental health awareness, that's right.
Is it a week or is it the month?
They get a whole month to themselves.
Okay, good. I guess that's great, because the more awareness that gets out there, the better, it is for us to understand what people are actually going through, right? Yeah, so we were kind of touching on this last week.
I know, Lou, I need to work on cloning myself.
I can't handle 2 of you, so no, we're good.
You would love that.
I would not.
That's
Stop.
like double the pleasure.
For who?
I don't like your attitude.
Okay. I don't even know what we were talking about, because I'm not sure what just happened.
Because we were talking about the fact that mental health illness month, it's just a month, but yet, like, really and truly, I think more awareness needs to we need to talk about mental health more, because it's so stigmatized, is what I was trying to say.
And what's scary about it too is that it doesn't present like a normal disease would. So, oftentimes people who are dealing with mental health issues look the same as everybody else. So, when you're dealing with people in the public and you're dealing with people at work or, on the street or in the grocery store or whatever, you really don't know a person's stability. You don't know what they're dealing with. You don't know who's who, and that's, I think, the scariest part, as I guess on both sides, because, you were talking about the early stages with your mom, when you would walk through the mall, or when she would go with her caregiver and stuff outside. You would never know, if she were to bump into somebody, what type of reaction she would have, or what type of, what would come out of her mouth,
exactly.
How other people would perceive her or react and stuff. And that's with Alzheimer's. So with mental health, that's just such a broad spectrum of so many different diseases and issues and things that fall under that category. It's really concerning, the amount of people out there in our society that are going through issues, and they just don't present as something that we would, take a look at and say, oh, that person's going through that, or that person's sick, or that person has cancer, or that person has Alzheimer's, or, it doesn't show up. So it's difficult to kind of.
Well, it's the same thing. Like, when you're a caregiver too, you start becoming socially isolated, and you stop talking to people because you don't think they'll understand, or like you're going through your whole set of emotions on a daily basis, that you become depressed.
Yeah.
And you're not getting counseling. You're not looking after your mental health. So it can become very problematic if you don't assess yourself and go, look, I have to talk to someone. We need to, obviously, more awareness. We were talking about that people that are caregivers, even if there's very little support from the local health integration network, but in addition, that's only just for the person suffering from Alzheimer's. What about the caregivers? Like, what about even counseling, even free counseling would probably be very beneficial to a caregiver.
Having somebody to talk to, or to relate to, or to vent to. Yeah, absolutely.
And not like, they'll say, some of the Alzheimer's societies will say, oh, we have support groups and we have this and we have, no, but if you don't have time to breathe, do you have time to go to a support group and sit and to hear about their problems? You have like 20,000 of your own. You don't want to sit there and just start talking about a group of problems,
Yeah.
That's more depressing.
Yeah.
And then, you might think your problem, if you hear somebody else's problem, you might think, oh my gosh, and I'm complaining about mine and they have it way worse. Like, you need, I think for support, you just need maybe to even have someone just to listen.
Right. So you could actually get things off your chest and be able to kind of
in a safe place.
your experience and what you're feeling and going through.
And maybe someone who's obviously gone through it, so they can give you maybe some suggestions or whatever.
Yeah, I agree. So Cindy says, with so many mental illnesses, 1 month is not enough. Where is anxiety awareness a month or depression awareness month? Grr, yeah.
Okay, did you have to do the grr?
No, I didn't. Well, I'm reading it and I'm like, grr, grr, grr.
I'll be over here.
Grr. So you couldn't make that grr longer, so I knew it was like a
angry
grr.
emoticon.
She set me up with that one. She did.
And I'm like, no, she's not. Yeah, she is.
Grr.
Colleen Taft from Brampton and on Facebook does a lot of mental health work. Okay, that's Karen. Thanks, Karen. So, that's how I heard it in my head. That's what she said.
Thanks for that, Cindy.
Okay. All right.
Grr.
But good point. Why is it only 1 month? Anyways, who's telling anyone, who's dictating these things? Who's making this stuff up? Who's responsible for making the months up? That's what I want to know. Like, who decides it's mental health? Who said that? I want to know. Inquiring minds want to know who said that it's mental health illness month and they decided it's this month, May.
Perhaps one of our viewers
Does anyone know?
can let us know.
Are we just like minions? Like, I don't understand. Who makes these things up?
Good question. Okay, moving on. So, anything else that you wanted to add when it came to that?
Exactly. So Karen's saying exactly what we were just talking about earlier of the Alzheimer's Society does have support groups in their districts. However, how are you going, if you're looking after your parent or your spouse or a loved one, how do you get away to go to the support groups? Who's looking after your loved one when you attend them? And I don't know, when my mom was in the early stages, there is no way, that did not entice me at all to go to any support group. I would stay far away from them because I don't see how that would have been helpful to me to have a group of people, talking about how challenging it is. It's already stressful. I don't want to hear more stress about it.
So maybe in these type of groups, not so much making it a venting session, but more so having a solution-based type of session where you guys can come together and talk about different ideas to help your loved one stay busy or do activities or bring them to different social gatherings that might, I don't know, just solutions that might help the situation that, that you're feeling so isolated in. I'm not sure. I don't know.
It's such a broad issue, and that's just the tip of the iceberg. Like, it's very reactive. So there's not as soon as you get a diagnosis, it's sort of like you're on your own. There's not okay, so let's say you go to the doctor. Okay, your loved one has Alzheimer's. Oh, okay, but then it's not like, okay, this is what you have to do. It's
sorry to hear that.
Yeah,
that's too bad.
Well, wow, that's a lot, right? That's what your diagnosis is. It's not like, okay, well, number one, see, if I had to do a list now that I know, it would be, okay, your parent has Alzheimer's or your loved one, do they have CPP disability pension? And here are the forms. Go get that done. Probably.
Yeah, so like a list of, you just got diagnosed with Alzheimer's, here's what you do. You know what I mean? Like,
call CCAC or Lynn. Sorry, it's Lynn now. Call them immediately. Put your name on a waiting list. Like, these are things that you're gonna get a power of attorney. Like, sorry that it has to be like that, but time is of the essence with Alzheimer's because it's a brain, it's neurological. So you don't have time to think about it, and it's unfortunate because you're human, so you're gonna be in that shock stage, right? Like, what? But you have to go because it could be, it depends it could be immediate
That's
or
what
gradual.
I wanted to talk to you about, because that's an interesting point. I think you brought it up either last podcast or the podcast before. You had mentioned that your mom had frontal lobe.
Frontal temporal, yeah.
Okay, so, and for people who are new to this or don't really know what that means, you know, with your brain, there's so many different sections of your brain, and so when the disease actually hits you in different sections, there's different things that are going to trigger in terms of memory loss, what goes first, what, you know, your speech, your memory, your actions, like, so give an example with your mom.
So because it was in the frontal lobe, it was her speech comprehension, that's right here. So her language was the first to go. So she became, and I know my mom, so she became quiet because I think things weren't coming out right. So she's, you know, mom, she's too proud, so
Very.
she would just be like, and then
Yeah, if I can't cuss you correctly, I'm not gonna cuss. Yeah.
Hey.
Yeah.
So she became quiet, and then she would, you know, you would think that she knew what she was saying when you're like, "Hey, mom, how's it going?" And she'd be like, "Good," and you're like, "Oh." But I just think it was just
repetition of the same stuff.
And then the more she stopped speaking, the more she lost it, because it's use it or lose it when you're an adult. And then that was hard. But then she started speaking a different language. And when I mean a different language, it's not a language, it was her own language.
Like gibberish
yeah,
almost.
because things weren't coming out right. So it was just because of the brain. So, you know, as much as people would say, like, oh my gosh, they asked the same question, or I had to repeat, or they talk about things in the past, you know, I just wished that I even could hear my mom's voice, because I forgot how it sounded, you know, and I can't have a conversation, obviously. I lost that ability, because she used to talk about things, and then I would just play along like I knew what she was talking about.
Mm-hmm.
Like we look at pictures, and she's like, you know, that guy. I'm like, and then I just think, oh yeah, that guy. I don't know that guy. That guy is, I don't know, but like, but at least, you know, at least you had an interaction with her.
Right.
But then when she stopped talking, and then she became apathetic, so it was tough. So yeah, depending on where Alzheimer's, or sorry, the plaque in your brain, because it's actual plaque, which it actually looks like Brillo pads, right? So when you look at a scan, you can actually see like a dark area in the brain, and that's neurons dying, and they're never going to be regenerated. So it's different. So that's why Alzheimer's is always usually depicted like you'll see like the brain kind of like scattered or puzzle pieces missing, because that's really what it is. And it's like I probably view it as like lights going out in different parts of your brain that are never going to come back on.
The neurons
like
don't fire
shut
anymore.
shut down until eventually it's all down, right? That's why, you know, people just think it's, oh, you just forget. No, your brain is shutting down piece by piece, which means like you're going to forget how to talk, you're going to forget how to walk. She probably can't see. I'm 99% sure she can't see. She can still hear, but she can't walk. You know, like, so you think about, and that's why I always refer to it as reverse aging, because it's like the brain is shrinking to now like a newborn, right? And it's like, look at it. I can't walk. So look, I can't walk, right? A baby can't walk. They have to learn how to walk. She can't walk. A baby's on puree, right? Until they're on solid. She was on solid. Now she's on puree. And then eventually she won't even be on puree, because she won't be able to swallow, which she can't swallow now. She can swallow. That's usually the last to go, where she'll forget how to swallow, and then that will be it.
Yeah, and I've noticed that too with her eyes. Like sometimes I try to track her eyes, and she doesn't follow my finger, or she's looking at something and it's just
Yeah, it's like
It's
a blank stare.
Yeah.
Like you don't know what she's looking at. Because I
Mhm.
don't think, maybe she can see shadows, maybe, I'm guessing, but I don't think she can pick out like a face. That's why I think she might respond to your voice, because maybe it's a familiar voice. So yeah. But she has the grip of steel. Like, I don't know,
Yeah.
she still has the strength.
Yeah.
I don't know where that comes from.
Yeah, she definitely.
That's like weird to me.
So devastating. It's, man, it's still very hard to accept it. Like,
Well, I'm in the acceptance stage.
I haven't gotten there.
I know it takes a while. It takes a while.
I mean, my brain tells me yes. Obviously, I know, like, we're talking about this. This is real. This is her 18th year. You know, this is my aunt that I'm looking at. Like, I'm conscious of what is, but I don't make the connection of it making sense. Like, it doesn't when I'm looking at her, and when it just is wild. It's really unreal. And, you know, again, it's one of those things that I don't wish on anybody, but it's like anything else. You really do not have a clue until you are in something like this to see it and to experience it and to feel it and to look at it. And it's just, wow, there's no words. It's just devastating, really. It really is.
And it's long. It's, you know, and you don't, it's a lot of the unknown. So like, you don't know, is she suffering? You know, what is she feeling? You think she's not. Maybe she isn't, but maybe she is. I don't know.
Mm-hmm.
Like, I have no way of knowing it.
Right.
And, you know.
Have you seen her cry? When was the last time you've seen her cry?
A long time.
Long time, right?
Because she doesn't.
Tears.
She doesn't. I don't think she would understand what that is, right? Like, I think you need to know if you're sad.
Like a baby would cry, a newborn would cry if it's wet or if it's hungry or if it's,
No, 'cause
you know.
maybe even that part of the brain, she probably doesn't even know that. But
So if you were to hurt her, like if you were to inflict pain on her, would she just like grumble?
You're gonna try?
No, I'm saying, would she actually physically, like crying is no longer an option?
I think she would know if she's uncomfortable, because she'd probably make a sound if she's uncomfortable.
Mm-hmm.
Yeah, but not cry, like in, you know, like for sadness. No.
Mm-hmm. Wow. Okay. We were talking again too a couple of weeks ago about how early this is now starting to present itself. You know, within our generation, it's no longer an old person disease where people just think, you know, you're retired and in grandparents and great grandparents. This is presenting younger and younger and younger. I mean, your mom was diagnosed at 57, which is super young, like not even retired yet. So that's super young. You know, and we were reading up on, or not even reading up, I had seen a YouTube clip.
Sorry, she just turned 57, now that I think of it, because her birthday is in July.
Mm-hmm.
And it was August of that year that she was diagnosed. So she, you know, so technically, and we all know it presents you probably have Alzheimer's 10 years prior to the diagnosis. So, you know, she probably had it at 47, right? That's why it's very, hi Jane. It's probably very necessary to, and I'm sure they're working on it. Biogen actually is working on a drug that's asymptomatic for people, I guess, who probably have genetically predisposed to Alzheimer's or dementia. And I'm just really excited about that drug because, again, it doesn't wait. It's not reactive. It's proactive. So
I looked it up actually. How old is the youngest person with Alzheimer's? The answer on Google is it is very rare to show signs of dementia before age 40. However, the youngest person ever diagnosed with Alzheimer's was 27 years of age. Alzheimer's and Down syndrome are both on chromosome 21, and patients who have Down syndrome invariably develop Alzheimer's if they live long enough.
A lot, I want to get into that, but Karen said so true. When we were talking about the lack of crying, my mom not being able to cry. So Karen's mother has Alzheimer's, and she's saying so true. They lose the ability to show sympathy and empathy, and she's 4.5 years in. So think about how quick that has happened.
And Karen, does your mom have the same, like, is it in the same place in the frontal lobe as?
I don't think so.
Different?
Well,
Okay.
I can't. Well, if it is, your mom didn't lose her language yet, right? As far as I know, she hasn't.
Okay, so going back to the youngest person, 27. 27 is, I don't even have words for what that is. I can't even imagine. And I remember seeing this YouTube clip how the woman had literally just gotten married. I think they were on their honeymoon, and when she went to the doctor to find out what was going on, they found out she was pregnant, so she was excited about having her first child, recently married, so newlyweds, and then bam, got the diagnosis that she has Alzheimer's, and the husband's like, what? Like, so going through this pregnancy, it was wild to watch this clip, because he's now taking care of this wife, his wife, who he married in perfect health and young and vibrant and beautiful, and now has to walk her through this pregnancy, almost like, you know, explaining to her what's happening to her brain and her body, and like having to teach her how to walk again and how to do all these things again, because it just hit her so quickly. And, you know, she's going through this disease at such a young age. So now, you know, not only is she about to have this baby, but she's having a baby with
A baby.
It's just wild.
Like me. Kind of.
What?
Well,
Oh,
I
when
had
you had
Jalen
the
and
newborn,
Mom
yes.
was diagnosed.
Yeah.
I know Luann's just saying she has to go back to work, and we're doing a great job. So that's it.
Thank you.
Thanks from Ireland and tuning in. Love you, Lou.
Okay, so yeah, it's just to show you guys that, you know, this preconception of it being an old person disease, it's not. And I think the more, you know, the more educated we get in terms of what's out there and what, you know, we can do in terms of preventative measures. Like I was reading, you know, there's a lot of things that doctors say. We can eat more fish. We can do all of these things in terms of like keeping our minds active with Sudoku or these puzzles, or, you know, just always, you know, challenging your mind and your brain to keep it moving, to keep it thinking, problem solving and stuff like that. You know, there's different ways you can try and do things to prevent, but I mean, these are real diseases that we really need to kind of get in tune with here, you know, and don't wait until it hits for people to start understanding.
There's my namesake. Hi, Karen.
What was this message before?
It's Kalina. She was talking about her grandmother and that her teeth are hurting her, so now they're worried about her eating. And it's been really difficult for both. And it's difficult for her grandmother to express and understand how, like, what she's saying and feeling.
Yeah, frustrating for sure.
The scary thing is, especially with a dementia patient, well, I'm going to go by my mom's situation, it's harder when something like that happens. So, to give an example, my mom fractured her ankle, and then we had like that air cast, and because I guess her brain is telling her when she puts pressure on her foot, it hurts. So then
she just stops walking.
Right, because she doesn't remember how to walk. And it all was because of that ankle. She was walking fine until that, and then she forgot how to walk. So when things like that happen, like in Kalina's case with her grandmother, and like her teeth are hurting her, and then she doesn't want to eat because her teeth are hurting her, right? So she's going to remember that. It's like a child.
Associating.
Like how you learn things, right? So now the fear factor is, was she going to stop eating because she's going to associate pain with
her
eating,
mouth? Yeah.
Right? So you're always have to be on guard of, oh gosh, what's going to happen? I always used to say it's like trying to solve a puzzle, but then when you solve that puzzle, there's something else.
Yeah.
And it's so systematic. So like, soon as something else happens, you have to be like, you have to catch it right away.
So Cindy said, same thing with my dad. It became a choking hazard, or he was refusing to eat, couldn't say it, so they switched to puree, and he was much more receptive.
Yeah, maybe Kalina, maybe it's the time for puree.
Or softer foods.
But
Definitely.
puree, like, I don't know, maybe it is. If her teeth are hurting her, I think that's probably the best route. Because it's now, okay, so my mom used to go to the dentist, like, with me whenever we go, and then until, like, until she couldn't. So unless,
We are on puree
okay,
already.
okay. Is it still hurting on puree? Or is she afraid because of the pain? Or maybe they don't know what's wrong with her teeth. So it's like, and then that's the other thing. So how do you explain if somebody's afraid of the dentist? Like,
Yeah.
This is what I'm saying. It's like a catch-22. What do you do in that exact situation? So let's say my mom her teeth were hurting. She's not receptive to a dentist, but that's going to solve the problem. Like, what do you do? That's a very... I'm speechless.
That never happens. I mean... So on that note, yeah, these are definite subjects and questions and solutions that need to be talked about and figured out. Yeah, real concerns, real issues, for sure.
Okay,
Very
so
scary.
wait, yes, Kalina, she's refusing to eat with puree? Is that what I'm understanding? And that's because she's associating the pain. No. But of course that would be, like, it's like anything else. Yes. Oh my gosh. Okay. That's okay. Uh-oh. So I think you probably should ask Medicaid, or I don't know who's supplying these nurses that come in, if they can supply a dental hygienist or a dentist to come in to see your grandmother and figure out what's going on with her teeth. Because if it has to be whatever is going on, if it has to be extracted, maybe that's the best solution. If there's a problem, like, you're not going to try to fix the problem, just extract. Like, there's no sense. Just extract the tooth.
And there's nothing worse than when your tooth is hurting.
Yeah.
Like, toothache is the worst type of pain.
Mm-hmm.
It's just awful.
And then they can at least localize and then just take it out.
Yeah.
Whatever it is.
Yeah.
That's probably the best and the easiest solution. And I'm sure I'm sure that's covered. I'm sure somebody would be able to do emergency surgery on your teeth, dental surgery on your teeth. Or you'd be able to bring her somewhere, because that's an emergency. Especially with your grandmother, she must be in severe pain.
Okay, so that being said, we wanted to cut this a little bit short, or shorter, because we tend to kind of keep going like longer and longer, but we just wanted to keep this as condensed as possible. We are grateful for all of you guys for tuning in as usual, and for all the support, the likes, the reshares, the comments, everything else. You guys are awesome. We are grateful for our viewers. We're grateful for all of you guys just supporting this journey. It means a lot to Karen and to myself. Obviously, we're doing this out of it's a love thing. It's unfortunate that it has to be under these circumstances, but we're so grateful that we're able to do this and at least help whoever it is that's going through this journey, themselves. So,
okay,
wow.
So on that note, I think it's the worst. They just worry how would respond to the recovery. Thank you, ladies. No, I don't think you should worry about that. Like, Kalina, I really don't think you should worry about that. You have nothing to worry about a teeth extraction. Just make sure they come in and do it right away before it gets worse, because it could get infected, and that's even worse. And then, like, obviously tooth decay, I'm not like a dentist, but it affects other things, like your heart, like
Yeah, it's a chain reaction.
Yeah, like, so I think right away it's necessary. And she will recover. My mom went through something similar. Not like that, but where she had to extract a tooth because it made more sense. And, well, fortunately it was at the back, so it wasn't a big deal. But, yeah, I would do that right away.
Yeah, for sure. Because even just thinking about, you know, us on a daily basis, when you have a toothache, it's no joke. It's not fun. It's not nice. It's not something that, you know, anybody wants to go through and really feel. So especially in these type of situations, if they're not, you know, coherent or in their right mind to be able to express how they're feeling or the pain that they're actually going through, it's definitely something that you need to look into and get that fixed and figured out, for sure. So again, Cindy, thank you. Take care of yourself as well. Kalina, thank you for tuning in. Guys, all of you, we are so grateful and appreciative for all of your support. I've said this before. Sorry, a lot of distraction going on. I apologize, you guys. We're working on that. And we will definitely tune in next week. 6 days of this. Okay, hopefully
Kalina,
tomorrow.
6 days. Oh my gosh, you've been going through so much. 6 days of this, and tomorrow you're going to get antibiotics. Wow. Okay, yeah, get on that. Let them just extract the tooth. Yeah.
So good luck to you and to your grandmother. We will tune in, or even just leave some comments and let us know how that progress is going, because you know we'd like to know, we'd like to hear. Good luck to all of you guys.
Yeah, message me, Kalina, and let me know.
We'll tune in next week, and make sure you guys are here, same time, same place, 6:30. We always try to, tend to get on here and see what everybody's doing and see what everybody's saying. But we're gonna tune off or tune out or tune something, because there's just a lot of stuff going on right now.
I didn't notice. Did you know? There was nothing. It was quiet.
That's what happens when you get children. Under, how old is Jalen? 17? 18? Yeah. My kids are under 10.
The noise is different in my house.
Yeah, with the earphones
like,
on.
I don't think he speaks in coherent sentences.
Mine just don't even realize that they're being
Come on.
loud.
Did you see that? Yeah. It's like Fortnite, it's Call of Duty, it's NBA Live. Like, it's a lot going on.
Yeah, so it's dinner time, prime time. We got to get these guys going. All right, so you guys be blessed. Stay blessed. We will see you next week. Peace and love, all that good stuff. Thanks for tuning in.